Pancreatic cancer is currently the third leading cause of cancer death in the United States. Only 9% of people diagnosed with pancreatic cancer survive for 5 years. The vast majority die within 1 year of diagnosis because by the time they learn about their condition, the cancer is advanced. Early detection is a critical step towards increasing the survival rate. However, standard diagnostic tools and established early detection methods currently do not exist. Since most patients have a later diagnosis, they are not eligible for surgical resection. Thus, tests that are capable of detecting the disease in its earliest stages are urgently needed. Most pancreatic cases are diagnosed by running computed tomography (CT) scans, magnetic resonance imaging (MRI), endoscopic ultrasound (EUS), endoscopic retrograde cholangiopancreatography (ERCP), laparoscopy, and biopsy. But these tests are not 100% effective at successfully detecting all small lesions, precancers, and early-stage cancers. Early screening methods are especially important for those who are at an increased risk due to genetics and other factors. A blood test that identifies a certain substance in one's blood that is indicative of cancer is a suitable detection method due to ease of use and cost effectiveness. Researchers across the country are constantly searching for new pancreatic cancer biomarkers that can be used in a diagnostic test. They conduct various studies and are starting to yield promising results. In a recent study, researchers developed a cost-efficient and non-invasive blood test. This resulted in 98% specificity, which is the ability of the test to correctly identify those without the disease, as well as 87% sensitivity, which is the ability of the test to correctly identify those with pancreatic cancer. They did this by screening for two of the new biomarkers they identified called THBS2 and CA19-9. The results of the study show that THBS2 and CA19-9 may possibly improve the early detection of pancreatic cancer. Progress is in the making, and future studies can help confirm and expand upon these results. Due to the lack of knowledge and methods for early screening, physicians believe that participating in investigational studies targeted at people who have a high risk for pancreatic cancer are important. The existing options of research programs for those at high risk include surveillance programs and family registries. The objective of surveillance programs is to detect early pancreatic cancer and precancerous lesions in people who have a high risk for the disease. Such programs will hopefully provide extensive information about who is at risk, which genes are involved in developing pancreatic cancer, and the most ideal methods for early diagnosis and treatment. For more information about surveillance programs, please contact Patient Central at the Pancreatic Cancer Action Network. Family registries are collections of patient data that may allow researchers to potentially identify other risk factors and/or genetic conditions associated with pancreatic cancer. They examine environmental factors, lifestyle habits, and history of the disease, along with incidents of other cancers in the family history. For more information about family registries, please contact Patient Central at the Pancreatic Cancer Action Network. Current research in early detection includes using genetic analysis to look for specific genes and mutations within genes that could be associated with pancreatic cancer. Proteomics is another part of research that analyzes samples of biological fluids for patterns of protein expression unique to a certain disease. New imaging techniques are becoming more effective as they allow doctors to search for minute changes in the cells of the duodenum that could be indicative of pancreatic cancer. Researchers are also analyzing other biological fluids such as saliva and blood for biomarkers in patients that have the disease currently. Although early detection methods are progressing, it is imperative that we uncover an established screening tool so that we can help increase the survival rate of pancreatic cancer. For more information about early detection and pancreatic cancer, please contact the Pancreatic Cancer Action Network.